Stephanie Stewart asked the question about sciatica, and really what I did is with the article, I went through a couple types of pain with sciatica. This is Dee, my medical assistant. She's helping out. So in the article, I went through disc bulge, and there's several different types of disc bulges. L1 comes across the groin like this. L2 comes here. L3, L4 goes across the knee into the foot. L5 goes down the side, crosses over right here, and goes to the big toe, and S1 goes all the way down the leg to the little toe. Next comes piriformis syndrome, which is a muscle spasm in the buttocks, protecting a couple different things that I'll talk about in a second. And it goes straight down the back, okay? Facet joint, which is these little joints right here, and on D's back, it's way down here. Each of those have somewhat of a referral pattern, kind of into the buttocks, down the back of the leg. The SI joint is right here, and right down on her buttocks, right? And this is the sacrum, this is the ilium. This joint right here causes pain to the back of the knee. But it can cause spasm of this piriformis that we talk about that goes all the way to the foot, okay? Next, hip joint. Hip joint can cause pain right through here. A lot of times people get pain right here with the hip joint, but it'll go down this way. Spinal stenosis, which is a narrowing in the canal, causes pain anywhere in the low leg, except it causes it when you walk and it starts getting numb and then you rest and it goes away. Meralgia parasitica, there is a nerve running right off this edge that you lean into it and it starts getting irritated, and then you come off of it and the outside of your leg goes numb when you come off of it. IT band is right here, right, and that causes pain here, and there's that's the hip bursa, and then the IT band runs down this way, so people get numbness, or at least pain down that way. Shingles, which people have heard of shingles. Shingles causes pain in any of those nerves that I described with the disc bulge. Then we start getting into some weird things, like pelvis or spine cancer can cause a referral to any of those areas. Infection inside the spinal canal or even in the bone can cause it. Vertebral fracture, each one of these are vertebrae. Any of those can cause pain down the leg. Femoral hernia is where the femoral nerve gets entrapped, kind of right down in this femoral canal, and it causes pain the same way as the hip. Obturator nerve, people start getting pain right here, which is a weird impingement in the pelvis. Saphenous neuralgia causes pain all the way to the little toe. On each one of these facet joints, you can have a cyst that can cause nerve pain down the leg, and then spondylolisthesis, where one of these slides forward on the other, can also cause pain down the leg in the same way. So the point of this was to be kind of like a evolution of dance type video where I go through the thing really quick and try to explain that there's an extraordinary number of things that can cause pain down the leg. So when you start asking the question of what am I going to do about my sciatica, you have to realize tons of things can cause sciatica. I'm not trying to teach a medical school class here. What I'm trying to do is provide some understanding of the diagnostic dilemma of leg pain. Okay? Great.